Colic and reflux in the newborn is a really painful and stressful issue for the child himself, but also exhausting for his parents, who often find themselves tired, stressed, and helpless in the face of a crying, sick child. All this is without taking into account that when a child is very irritable during the day, the parents and the child himself are precluded from fully enjoying the abstract relationship and emotional bonding that is created in the first months of life. A period also of unrepeatable and extremely sensitive physical and cognitive growth. After numerous years of study and work, during which I have solved thousands of cases of colic and physiological reflux, so to speak, of the infant, I have learned how to treat them and even better how to prevent them easily. Aware of the enormous help I can offer to thousands of babies, in this course I have decided to reveal to you all the tricks I have among the parents of my little patients since pregnancy. Anticipating the superficial and hasty phrase colic passes by itself around the 3rd or 4th month of the baby's life, because they are due to a fateful immaturity of the intestines, is false and dangerous. Dangerous because some studies have shown that the infant with unresolved colic in the first few months of life has an increased risk of presenting with sleep, attention and mood disorders in the first few years of life, so he or she can be defined as having a difficult temperament. Now let me explain why the phrase colic is due to intestinal immaturity is false. I demonstrate this by starting with a wonderful scientific study from 2018 that documented how colicky babies have inflamed intestines, which is very different from immaturity. Scientific studies have documented that in the stool of colicky babies, there are increased fecal calprotectin values. For those who do not know, fecal calprotectin is a parameter that indicates the degree of intestinal inflammation, and to be precise, the study found in colicky infants who are breastfed have fecal calprotectin levels that are more than 2 times higher than those of infants without colic, resulting comparable to the levels found in infants with inflammatory bowel disease. I don't want to stop there. I want to reveal even more about the course, the so-called colic synonym vulgarly used to refer to the irritability and crying of an infant. In addition to having a cause of intestinal origin, have other causes. Yes, you got it right. The onset of colic and also reflux is due to the presence of one or more incorrect factors in the mother or baby. Let me explain further what I mean when I say that there are many factors to pay attention to. I mean that colic is a multifactorial issue. That is, it has many causes. Am I saying something new and science fiction? Absolutely not. A study published in the journal Gastroenterology Clinics of North America, in the Office of North America, in 2018, entitled Infant Colic, New Data on an Old Problem, reports literally the following words. Infant colic is probably a multifactorial, including gastrointestinal, hormonal, psychological, and other factors. To this definition, I would add that colic is a multifactorial problem whose causes originate from as early as maternal pregnancy and continue into childbirth and the first months of life. To explain even better, I will give you a concrete example by anticipating one of the main factors that cause colic and reflux, namely what the baby eats: milk. In artificially breastfed babies, it is imperative to know what the maternal feeding was during pregnancy. Assessing the baby's position during bottle feeding, the rhythm of feeding, and the type of formula. For breastfed babies, it is essential to investigate maternal feeding. Again, assess both what the maternal feeding was during pregnancy and what the feeding is in the postpartum, so during the breastfeeding itself. That's one of the reasons I said that to prevent colic and reflux, you have to start as early as pregnancy. The results you get are completely better and easier. At this point, you are probably wondering, but how? Especially after giving birth, I was told that I can eat anything because my diet does not affect the baby's well-being. If it's any comfort, I've read this statement in hundreds of blogs as well. But not only that. In all the residency tracks and other in-depth courses I have attended, no one has ever tried to raise the question of whether maternal nutrition positively or negatively affects the baby's gastrointestinal well-being. And I say gastrointestinal well-being of the baby because the digestive system is a single tube. Food enters the mouth, goes into the esophagus, proceeds into the stomach, and then passes into the intestines. First the small intestine, and then the large intestine, until it is expelled from the seder through poop. If what you eat is no good, it irritates the stomach first, and then passes into the intestines. This is why it is impossible to get off the prevention and treatment of colic from that of gastroesophageal reflux. Parenthesis closed. Where were we? Yes, when asked, especially after delivery, I was told that I can eat anything because my diet does not affect the baby's colic and reflux. Think about it. How does the gastrointestinal issue not be affected by the first factor that comes into contact with the gut itself, that is food, in this case milk? If you have an upset stomach or an upset stomach, what is the first thing you think of? I must have eaten something that made me sick. What about in the infant, on the other hand? Is the neonate a greenish-colored extraterrestrial with an anatomy completely different from ours? Or is it a tiny human being that functions just like us? I want to give you time to reflect, so I will go further. For years now, it has been scientifically proven that maternal nutrition influences from pregnancy on the development of the baby itself. But not only that, foods ingested by the pregnant woman pass into the amniotic fluid and give it flavor. In addition, amniotic fluid is swallowed and experienced by the baby. As early as when it is in the mother's belly, the fetus starts swallowing the amniotic fluid and also peeing in the belly. To make matters worse, maternal nutrition has been scientifically proven to influence the taste of breast milk even after birth. It is for this reason that as early as pregnancy and during the first few months of life, the mother can facilitate the baby's approach to certain flavors by letting it taste through her own feeding. Yet despite all this scientific evidence, no one has ever thought that maternal dietary quality may play an important role in the onset and treatment of colic and reflux. No one has ever thought that maternal nutrition that scientifically affects the taste of the milk that is drunk and digested by the baby itself may also positively or negatively affect the baby's gastrointestinal system. No one ever thought that the only food that the newborn ingests and comes into contact with the gastrointestinal walls for the first 9 months of pregnancy and for all the months after birth can positively or negatively affect gastrointestinal well-being itself. After hearing these words, did not the slightest doubt that maternal nutrition could remotely account for any of those major parameters that I have previously told you about, and that influence in the presentation and resolution of the infant's very famous colic and reflux. Let's say that some doubt perhaps I have given you. If you are worrying about what science fiction type of feeding is needed to prevent or resolve colic and reflux, don't worry. The nutrition I'm going to tell you about, or rather, my nutritionist colleague, an expert in pregnancy and lactation, whom I have asked to help me, will be a Mediterranean diet with special precautions designed specifically to avoid colic and reflux. We will explain what foods to avoid because they irritate the baby's gastrointestinal system and that consequently create colic and reflux. But we will not stop there. Within the course, you will find an example menu compiled by my nutritionist colleague who specializes in lactation and pregnancy. There will be 4 concrete examples related to the summer, spring, fall, and winter menus. I care so much about this part of the course because maternal nutrition is critical for the prevention and treatment of colic and reflux, but not only that. In 2010, the World Health Organization officially announced that the implementation of certain good practices, including healthy eating at childbearing age and especially in the preconception period, significantly reduce fertility problems, improve the course of pregnancy, reduce your baby's risk of birth defects, and lay the foundation for its health. Well, I'd say we've already put a lot of meat on the table in these few minutes. But get ready, this is just the beginning of the course. In the course, I will explain to you in full detail what all the factors are that cause your newborn's colic and reflux during pregnancy and the first few months of life, so that you will know how to easily take advantage of them to prevent or solve your baby's gastrointestinal disorders. Get informed because your baby's health matters and it is you, the parent, who plays a key role in this journey. That's why, if you are a pregnant woman, have just given birth, or your baby is a few months old, this course is exactly for you. Forget belly aches, a constantly crying newborn and sleepless nights and so much more. Offer the best development to your baby. See you in the course with the Silva method for colic and reflux.